Director of the Community Mental Health Center, Dr. Virginia Rubain, says stress is among the causes of mental health disorders, and there is need for improved monitoring of this and other potential risk factors. Dr. Rubain was speaking on JTV Spotlight to promote this year's Incredible Race event as part of activities being hosted by the Community Mental Health Center to observe Mental Health Awareness Month under the theme Mind Your Health.
Very often people are experiencing symptoms of a potential mental health issue, but because we're not aware, for example, stress. I always say that stress is a silent killer. And what people don't recognize is that the body adjusts to stress until you're dead or something untoward happens. So not being able to sleep at night, eating poorly, not being able to concentrate, not having the motivation and the energy to do the things that you used to do previously, being irritable all the time, worrying, constant worrying, being fearful all the time. You know, these would be good indicators that you're not coping with life's challenges the way that you should. What I have found, I've been in the service now for the last 11 years, and what I have found is that people in this territory have gotten more savvy about their mental health. And I want to commend, and I think we could do even better, but now people are more aware of when they're not doing well, and they seek services before it becomes something more severe.
Chief of Medical Staff at People's Hospital, Dr. June Samuel, says some non-communicable diseases like hypertension or high blood pressure brought on by the inability to deal with the daily stress of life is affecting Virgin Islanders' mental state as well as their physical state. Dr. Samuel says persons need to understand that their mental health is supported or negatively affected by their physical health. Meanwhile, in April, police charged 6 male teenagers aged 12 to 16 years for setting a man on fire in the parking lot of the old Rightway supermarket building in Passaic. Dr. Virginia Rubain responded to concerns about the growing number of homeless persons, some deemed mentally unstable, who are sleeping at various locations around Roadtown.
Not everybody that we see who may appear to have mental challenges has the exact same presentation. But sometimes, even with the best intent, you build a home, but they refuse to go in it. So, you know, it's not as simple as just building a structure and herding people into it and saying, okay, well, nightfall, you got to go in here. Because I know of cases where homes have been built through the generosity of the government or service organizations, family members, and when presented with a home, the persons don't want to live in it. So I think that it has to be a tiered approach, and as I said earlier, unfortunately we have to look at it as a case-by-case basis because not every case is the same. But we do recognize that there is a need, and there have been discussions at the ministerial level what would be the most effective way to deal with this growing burden. And remember, it's not just the people that we're seeing on the street, but it's also the potentially homeless, those people who live paycheck to paycheck, and if they miss a paycheck, they're in trouble.
For the entire month of May, the Community Mental Health Center will have a variety of activities to promote good mental health. The Community Mental Health Center will hold its annual Family Fun Day, an incredible race starting at 7 a.m. on Saturday, May 17th at the Noah Lloyd Park. The Incredible Race competition is aimed to test the mental and physical endurance of the participants, foster camaraderie and team spirit, while highlighting the community's awareness of mental health and wellness. Teams can sign up now to participate in the May 17th event. The Incredible Race will be aired on JTV Channel 55. The Family Fun Day begins at 11 a.m. at the Noah Lloyd Park with face painting, glitter tattoos, games, a mini health fair, and music by DJ Dre. Proceeds from the event are used to assist people with the essentials used for their health and daily living.